Certain chemicals contained inside of the cannabis plant, called cannabinoids, might be the most powerful non-inhaled edible nutrients mankind will ever know. They may do for medicine what germ theory and antibiotics did, ushering in the next great advancement in human health and life expectancy. The public has known about the incredible nutrient-like characteristics of cannabinoids in cannabis for decades now and has pushed for permission to use them medicinally, but the United States federal government has fought lawsuit after lawsuit to keep cannabis as a Schedule I drug, meaning the highest law in the nation classifies it as having 0.00% possible medical use. The thing is, the Fed's official position on the matter explicitly describes smoking as the method of delivery to the body, which they claim to have zero medical value. Generally speaking, burning a substance, destroying most of it, and inhaling the smoke that's created isn't usually the most effective way to deliver nutrients to the body. Throughout time, the Feds have never publicly acknowledged the possibility of eating cannabis cannabinoids as medicine. What's interesting about the stubborn stance of our leaders that cannabis has zero medical value is that they actually hold a U.S. patent on the use of cannabis cannabinoids for the treatment and prevention of ischemic, age-related, inflammatory, and autoimmune diseases. The Feds have known about the disease-fighting potential of cannabis since at least 1974, when they discovered the cannabinoids inside of it to have cancer-fighting properties in mice. The National Cancer Institute, a federal agency, tested 4 common cannabis cannabinoids on mice with lung cancer and on lung cancer cells in test tubes. The cannabinoids were administered orally and ingested by the mice. 3 out of the 4 cannabinoids reduced the size of some tumors and slowed the progression of others, leading to a longer survival time than the untreated mice. The test tube cancer cells were also impaired by the cannabinoids. At that time, science had no explanation for why cannabinoids could show to be anti-cancerous. The pieces started to come together in 1988 when the first endogenous cannabinoid receptor, or endocannabinoid receptor, was found in the brain of a rat. Soon after, it was discovered that endocannabinoid receptors are replete throughout the mammalian body. They are in every bodily system: the brain, blood cells, internal organs, skin, and bones. These receptors are not unique only to mammals. Every living thing that has a backbone and a central nervous system has endocannabinoid receptors. In mammals, these receptors have been found to play a key role in many bodily functions. 2 distinct types of cannabinoid receptors have been identified, and a third type is suspected to exist. The first type, called CB1, affects the central nervous system, sleep, pain, memory, mood, smell, appetite, liver activity, cardiovascular activity, and gastrointestinal activity. The second type, CB2, affects the peripheral nervous system, immune system, gastrointestinal activity, and some brain activity. The endocannabinoid receptors are in charge of turning up activity in certain parts of the body and turning it down in others, acting as regulators to keep bodily functions in check. Then in 1992, it was discovered that the body actually makes its own form of cannabinoids, called endocannabinoids, to feed the receptors and allow them to do their important oversight job. Eating foods with omega-3 fatty acids helps the production of endocannabinoids, which are then created on demand by the body to feed any receptor that needs stimulation. The endocannabinoid 2-AG is in mother's milk. Since discovering that endocannabinoid receptors impact upon so many bodily functions, scientists have been determined to experiment with the chemicals that affect them and explore their potential medical use. While there have only been 5 distinct types of cannabinoids identified to be made inside of the body, there have been 85 unique cannabinoids identified so far in cannabis. There are cannabinoids in some other plants, like echinacea, but nowhere near the quantity or potential medical quality of cannabis. But because the 85 cannabis cannabinoids are illegal to prescribe and prohibitively difficult to research for medical use in America, researchers have instead been forced to create artificial cannabis mocking drugs to attempt to stimulate the endocannabinoid receptors and manipulate their actions in a helpful way. The technical definition of a cannabinoid is any chemical that is capable of binding to and activating an endocannabinoid receptor. Cannabinoids made inside the body are endocannabinoids. Cannabinoids found in plants are phytocannabinoids, and the rest are made by scientists in a laboratory. These man-made cannabinoids don't suffer the same automatic illegal status as their natural counterparts. Synthetic cannabinoids that gain FDA approval are allowed to be marketed and sold on the highly expensive pharmaceutical market. Today, there are 2 such artificial cannabinoids that can legally be prescribed to Americans. In 1985, the drug Marinol was approved by the FDA and entered the market. It is prescribed to reduce nausea and vomiting in chemotherapy patients and increase appetite in AIDS and chemo patients. Also in 1985, the drug Sesamet was approved by the FDA, but it was not allowed to enter the market until 2006. It is prescribed to reduce nausea, vomiting, and neuropathic pain in chemo patients and increase appetite in AIDS patients. Both Marinol and Sesamet are modeled after the cannabis cannabinoid THC. The only other pharmaceutical cannabinoid drug in the world is the low-concentration oral spray Sativex. It entered the market in 2003 as a treatment for multiple sclerosis patients to alleviate their spasticity and neuropathic pain. Because Sativex contains the real cannabis cannabinoids THC and CBD, it is illegal in America, but available in other countries like Canada, England, Spain, and New Zealand. Although Marinol and Sesamet are the extent to which an American can legally use cannabinoids, the research shows that endocannabinoid receptors could be used to do more than just fight symptoms. A search on PubMed.gov for the word cannabinoid yields 15,243 results. These studies, most of which involve non-smoked cannabinoids, show that endocannabinoid receptors could be utilized to have a uniquely profound impact on what is currently known as health. This is nowhere near a complete list, but here are 25 studies showing different diseases and conditions that could be treated or even healed by exploiting the endocannabinoid system. Breast cancer, artificial cannabinoids reduce the size and spreading of tumors. Prostate cancer, an artificial cannabinoid reduced tumor growth. Lung cancer, artificial cannabinoids stopped the growth and spreading of tumors. Pancreas cancer, an artificial cannabinoid inhibited tumor growth. Liver cancer, THC and an artificial cannabinoid impaired cancer cells. Cervical cancer, an artificial cannabinoid killed cancer cells. Colon cancer, an artificial cannabinoid reduced cell growth and killed cancer cells. Non-Hodgkin lymphoma, an artificial cannabinoid reduced tumor size. Leukemia, THC reduced tumor size and killed tumor cells. Skin cancer, artificial cannabinoids reduced the growth of tumors. Cirrhosis, an artificial cannabinoid reduced fibrosis. Hepatitis, THC inhibited hepatitis. Alzheimer's, an artificial cannabinoid protected neurons and reduced cognitive impairment. Parkinson's, THCV could slow progression of PD. Multiple sclerosis, an artificial cannabinoid reduced neurological disability and progression of disease. Arthritis, artificial cannabinoids protected cartilage from degradation. Cardiac arrhythmia, an anandamide and an artificial cannabinoid prevented arrhythmias. Insomnia, an endocannabinoid increased sleep. Sleep apnea, cannabinoids suppressed sleep-related apnea. Inflammatory bowel disease, artificial cannabinoids reduced inflammation. Depression, endocannabinoids may treat depression and anxiety. Post-traumatic stress disorder, an artificial cannabinoid could help control nightmares. HIV, cannabinoids inhibited TAT. Osteoporosis, an artificial cannabinoid increased bone mass and protected against bone loss. Nicotine addiction, an artificial cannabinoid could help smokers quit smoking. The bulk of trials that do move on to humans are those that show potential to control symptoms. For some reason, almost no experiments that show potential to actually cure disease move on to humans. Interestingly enough, in all of history, there hasn't been one study done testing the curative effect of ingested cannabis cannabinoids on humans. The only study on humans testing the disease-fighting properties of non-smoked cannabis cannabinoids took place in Spain in 2006. They took the lone cannabis chemical THC and directly injected it into malignant brain tumors of patients. As suspected, it had a cancer-fighting reaction in some of the patients' tumors, and those patients lived much longer than expected. But since then, no more clinical trials of this nature have been performed on humans. Despite the mountains of research showing the disease-fighting potential of cannabinoids, both artificial cannabinoids available to sick Americans are modeled after the same cannabis chemical, and all they do is alleviate a few symptoms. In 2007, using a new method to target the endocannabinoid receptors, the French pharmaceutical company Sanofi-Aventis came close to bringing America its next cannabinoid drug. They theorized that because CB1 receptors stimulate appetite, shutting those receptors down could help reduce appetite and help people lose weight. They didn't know exactly which CB1 receptors controlled appetite, so they made a drug that simply blocked as many CB1 receptors as possible. Their drug, called Acomplia, made it all the way to an FDA Phase 3 trial. Patients were indeed showing signs of reduced appetite. The drug also showed potential uses for nicotine addiction and metabolic disorders, but the FDA stopped the trial when some patients formed extreme anxiety and depression and attempted suicide. Patients with a history of depression weren't allowed in the study. Although Acomplia was not approved in the US, it was approved in Europe, and it was available in 56 countries by 2008. It quickly became clear, however, that its negative effects outweighed its positives, and it was pulled from the market by the end of the year. Other pharmaceutical companies like Merck and Pfizer were in pre-production stages with their own versions of weight loss CB1 blockers, but these programs were not fully carried out because of the failure of Acomplia. What Acomplia did is show clearly that if at least certain CB1 receptors do not receive endocannabinoids, then the body cannot function normally. Plain and simple, cannabinoid receptors are a part of the body and they need to be fed.